The biggest myth I see is that people assume the wetter you are, the more aroused you are, and the drier you are, the less aroused you are. Now, that's not always true. So one, there's genetic reasons that lubrication can decrease. There are certain medications that can cause decreased lubrication. Even hydration, how much you're drinking can decrease your lubrication. And certainly as women age and go through perimenopause and menopause, their lubrication will decrease. And that's sort of a part of the physiology that changes over time. So what can you do in terms of vaginal penetration? So for vaginal penetration, in terms of natural things, I mean, the biggest thing is just drinking more fluids. The more fluids you drink, the more likely you are to make more lubrication. Also, assess what medications you are on, because some of them can affect lubrication. So it can include things like antidepressants, oral contraceptives, and even antipsychotic or other medications for that are used for psychology. And so any of those medications and maybe others that you're on could affect sexual function, including arousal. And if you're not getting as aroused, sometimes that can affect lubrication, or they can affect lubrication directly. And so that's one thing is just very easy to do, very natural, of course, is to check what you're on. Even supplements may have some medications in them or components of them that can cause this. So always assess what you are taking that might be causing changes in lubrication. Now, other things you can do is you can use a vaginal moisturizer. These are usually made with hyaluronic acid. And they can essentially, just like people put hyaluronic acid on their face, they're making more moisture in that area. And so usually there's suppositories you put in the vagina, usually once a day or every 3 days, depending on which one you buy. And these can help, replenish moisture in the area. The other thing is if you are going through menopause, you may notice that the tissues are changing. They're getting a little thinner. You're getting a little less lubrication. Maybe it's a little more uncomfortable when you have sex. And so that's because during menopause and perimenopause, your estrogen levels go down. And when your estrogen level goes down, it actually changes the collagen content and the structure of those tissues to make them thinner and less robust, and also make less lubrication. So it's very easy to replenish this with vaginal estrogen.